Hi Sam, thanks so much for joining us. I'm joined by Dr. Sam Goss, who is a women's health GP, and today we're going to talk about your GP appointment after a pregnancy loss. So thanks so much for joining us.
Thanks for having me, Peter.
So you specialise in women's health.
I do, yep.
And what we thought, it would just be nice to go through, because it's such a hard time in a woman's life, and your GP can be a really good source or resource for a woman. And what is the best bit of advice that you can give when they're first making the appointment? Do you recommend that they tell the receptionist what it's about?
If you feel comfortable to do so, I think it's really helpful to tell the receptionist what's happened. You don't have to go into any sort of detail. So something like saying, I've had a pregnancy loss and I need to book an appointment with a GP urgently. That would probably be enough. Sometimes it's hard if the GP is busy or you can't get an appointment, and so giving the receptionist some information about what's happened then helps them triage the appointment urgency. And I know for me, or the way that I like to practice, is that if I have a regular patient, I may have already seen them for preconception planning, or I know them already. Even if I don't have appointments, if somebody rang up and said, this is what's happened, my reception would let me know straight away, and I'd find a time to fit them in, even if there wasn't a spot available. So that's where it's quite helpful, because if you just ring up and say, I need to see the GP, they're trying to think about where to put the appointments and how urgent things are. It can be really tricky to be able to do that without having that extra information. So if you feel comfortable to share, I think that's important, because then they can let the GP know as well, and the GP might be able to shuffle things around for you too.
Okay, and so when they come in after they've had a pregnancy loss, what sort of things are you looking for? And would you like them to have a list of questions for you, or what would work best for you?
I think I'd firstly like to acknowledge that this can be really overwhelming when this happens. A lot of the time when I see people that have had a pregnancy loss, it's actually occurred quite quickly. So they might find out they're pregnant and then only a few weeks later have a pregnancy loss. So they may not have even got a chance to go into the doctor yet to have their pregnancy appointments or those sorts of things. Or if it's not early, it can sometimes be really unexpected. So if we have, everything's been going completely perfectly well, and then they experience a pregnancy loss later in the pregnancy as well. And so when it's happened early, you've sort of got your head around that you are actually pregnant in the first place. That can be a bit of a shock. And then you've got to process sort of what's happened with losing the pregnancy as well. Or you might not even know that you've lost the pregnancy, you're just not really sure what these symptoms mean, if that makes sense too. So that can be quite overwhelming. If it's later on down the track, then that can be equally as horrible, because often people feel blindsided when that's happened, that everything's been going well and then all of a sudden it's not. So then that can also feel really overwhelming as well. So you don't have to have a list, I think is really important. But if you would like to have one, I love a list. I think it's really helpful to keep everybody on track. And I don't mind at all if somebody has written, a list of their questions that they want answered, just in case we do miss something when we talk about my usual spiel when someone comes in to see me. So really for anything, I love a list. But, for this, you might find it helpful to think of some of the questions that you need to ask, especially if something has been missed off as well, just to make sure that it's been covered. Yep.
And when a woman comes into you, what sort of things are you looking for? Or are you going to do a physical examination? Or are you going to order blood tests or ultrasounds? How does it go? Just so that they know what to expect when they're coming to see their GP.
So it depends is the answer to that a little bit. I don't like doing internal examinations on women unless they're absolutely necessary. And now that we've got ultrasound available, there's not a lot of benefit in doing an internal examination in a woman that's experiencing a pregnancy loss. But I usually offer it, if they would like me to have a look, because sometimes we can tell, so that you've got a little opening to your cervix, which can open a little bit when somebody has experienced a pregnancy loss. If that's been open or there's some bleeding, we can then confirm that on the spot, potentially, to say that this does look likely that it might be a pregnancy loss. But that doesn't happen all the time, and the definitive answer as to whether you've experienced a pregnancy or loss or not is an ultrasound. So if you don't feel comfortable having an internal examination, it is absolutely okay to decline that, and I think that's important for you to know. But it is important to do a examination of your tummy because we want to make sure that there's no tender spots that are happening. And the things that I'm looking for when I see somebody that's experiencing a pregnancy loss, firstly, I want to know what's actually happening. So are you just having some bleeding and we need to work out whether that is a pregnancy loss or not? Is there any life-threatening things happening? And the major one for that is what's called an ectopic pregnancy. So that's when the pregnancy develops outside of the uterus, and that can be life-threatening. So I look at that with pain, and that's what we do that examination for. And also that your symptoms are not so severe that you're going to develop complications from bleeding. So that might be you have a lot of bleeding, and that can make you feel really unwell, or you might even need a blood transfusion or that sort of thing if it gets really bad. So I need to know about how much bleeding is happening as well. So we would ask, and I've sort of gone a bit out of order here by talking about examination first, but we would normally take a history first. But I think what's important is that someone might be coming into a consult worried that they're going to be forced to have an internal examination, and I want women to come away from this talk to know that they do have some choice in that. They can decline that. It's not the most important part of examining a woman when they are experiencing a pregnancy loss. But the things that I think are important to do are checking your blood pressure and also examining your tummy. And it depends a little bit on some of your symptoms and that sort of thing. So I will ask you, how do you know that you're having a pregnancy loss? Have you experienced less symptoms of pregnancy? Are you getting any bleeding? How much bleeding you're getting? And the best way to know how much of that is to know how many pads you're changing, because that gives me a bit of an idea as to how heavy the bleeding is, whether it's spotting or whether it's like a proper bleed, like a period. Whether you're experiencing pain, and what sort of pain you're experiencing. So sometimes you get some cramps, and they can be perfectly normal as part of the pregnancy loss process, but sometimes you can have more severe pain, especially if that's one-sided. That would make me feel suspicious for an ectopic pregnancy. If you're feeling dizzy or faint, that can let me know that you might be losing a bit too much blood, and that might be a bit of a worry as well. And then, some history about the pregnancy itself. So I might already know you, so then we don't need to ask those questions, but I need to know how far along in the pregnancy you are. Have you had scans before? What blood tests have you had? Who have you seen about your pregnancy? Any risk factors? Have you had any pregnancy losses before? Those sorts of things as well. They're the main things that we look for when it comes to the questions that I'm going to ask you, and then also the examination that I'm likely to do. And so all of that stuff is looking at any medical complications, but I think it's also important is I consider how you're feeling generally about this. And like I said initially, you might be just feeling really overwhelmed and not really know where you're at. Or you might be feeling really sad. Some people might even feel relieved if it was a pregnancy they weren't sure they wanted. And so just know that any of the feelings that you have around pregnancy loss, they can be different than what you expect. You might feel a different way than you were supposed to. You may not. You may feel a bit numb. You may feel a bit not really know how you feel, and that is normal for this process. But I do check in to see how you're feeling generally in yourself about what's happening, and what sort of support that you might need, emotionally around that as well. Because it's a huge thing, but it can also be different for a different person as to how they react to these sorts of things as well.
I also think that your GP is a really good, tool to use to help with your mental health, because they know all the services that are out there. And so it's really important that you do tell your GP how you're feeling, even if you don't know how you're feeling, because they can actually get you referred to other services.
That's right, and we have quite a lot of things available actually for people experiencing pregnancy loss, and this has increased over the last few years. And so it might be some local resources that we can link you in with, or some more national resources or online resources. There's quite a few things that might be helpful, or it may not. You may not be ready for that at the initial appointment, and just tell your GP that, and then you can check in later if you need to. But I try and offer some easy to access online resources resources initially, at least, even if someone is not really sure how they feel. So then they can come back to those later if they need to, once things are sorted from the pregnancy perspective, and they've got a bit more time to process. Yeah.
And I just wanted to touch on briefly a missed miscarriage, and that your GP is really there to help not outsource, but get you in touch with anyone that needs be, even if they're not a women's health GP. So if women are experiencing a missed miscarriage, your GP is the person who can explain and go through the surgical options and the medical options.
Yeah, that's right. We can talk to you about the different treatment options for the pregnancy. And the thing about miscarriage is hard is that often when this happens, it's sometimes people know because they might notice less symptoms of pregnancy, and then they get a scan as a result of that. But most of the time they happen, very much out of the blue when you go in for your routine scan, and that's when you find that it's happened. So that can be really blindsiding. And also, sometimes the clinic that's doing the ultrasound may talk about some options, or where the referral, they might send you to your obstetrician or something like that. So you might bypass the GP potentially, if depending on what sort of care you've already been getting. But just know that we see this a lot. This is unfortunately it isn't uncommon, and GPs do see this as part of their routine care. And we can talk about even if we're not women's health GPs, we can talk to you about the options. And I guess while I'm on that note, there are 3 options in terms of a pregnancy loss generally, and most of the time we do what's called expectant care, which is allowing your body to pass the pregnancy in its own time, and that usually takes about a week or so, depending, and you'll get some bleeding and that sort of thing associated with that, and we monitor your blood tests while that's happening until return back to baseline. GPs can prescribe or some GPs, not all GPs would do this, but we can prescribe some medications to help your body pass the pregnancy on its own. And often the obstetrics clinics or obstetricians will also prescribe this for patients. So that's the next step, and you can also choose to have that if you're wanting things to speed up a little bit. And then you can also have surgical care to help the body complete the loss. So sometimes we need to do that if it's not happening on its own. And sometimes women actually choose to do that. Let's say that the bleeding is quite distressing for them, or they're finding the uncertainty of waiting until the body passes the pregnancy on its own difficult. Or the pregnancy is a bit further along, like when it's closer to the second trimester, sometimes they elect to do that as well. Sometimes, though, that's not suitable either. So they'll talk about those options, depending on your situation, really. But the majority of the time we do expectant care, particularly for those early losses, and they don't generally take very long in most cases. Yeah.
Okay, that's really helpful to know. We actually have 2 podcasts from a gynecologist around the surgical care and the medical care as well. But it's good to know that the GP is there to explain all of this to you. Do you have any other practical advice when they're coming to see you?
If you're having bleeding with pregnancy, you don't have to panic, provided that you're not getting pain and the bleeding is not too much. So if this starts to happen in the middle of the night, it's okay to wait till the morning if you're having low levels of bleeding and you're not experiencing pain. But if those things are happening, it's really important to get care immediately, and that might have to be the emergency department, unfortunately, if it is the middle of the night. But give us a buzz first thing in the morning. I certainly would fit in my patients urgently to check them for a potential ectopic pregnancy. It's really important to pick this up as quickly as possible. Sometimes I will just order the scan for someone, even without seeing them. My receptionist might say to me, this has happened this morning, and we just make sure that we get an urgent scan if they're getting pain. But if you're finding that you're not getting any pain, you're having a little bit of bleeding, but it's not too severe, it's less than a normal period, it's okay to wait till the morning. You don't necessarily have to go down into the emergency department. And there are some, depending on where you are, there there are some online, services available. There's a National Health Direct line that you can call with your symptoms of pregnancy as well, which I would highly recommend if you're a little bit unsure about whether you need to go into the hospital, or you can wait till the morning to see the GP. That's an excellent resource for you as well. And I also happen to work with one of those services, and we often have those conversations with early pregnancy bleeding. Should I be going to the hospital? Should I wait till tomorrow to see my GP? So just know that we're pretty experienced with organising that as well. But if you are unsure and you're a bit concerned that you've got pain or more bleeding than what you should have, then it doesn't matter, just go to the emergency department and get checked out. The worst thing that will happen is that they'll tell you that everything is okay and you do need to follow up with your GP or obstetrician or early pregnancy centre, but at least then you can be reassured that you don't have an ectopic pregnancy, and that's really important to know, because sometimes they do sneak up on you a little bit, and sometimes we can downplay our pain, as lots of women do, because we think it's normal to have some pain or that sort of thing. But I think if you're unsure, just get it checked, and a scan is the best way to know.
Okay, thank you so much for all that information, Sam. We really appreciate your input.
Thank you.